Yeah, my name's David Bauman. I'm a psychologist and behavioral health education director at Central Washington Family Medicine Residency in Yakima, Washington.
All right, so I'm going to ask you a few questions
All right,
about
I'm
your
excited
work.
to do this. All right.
Okay, so on a day-to-day basis, what do you find most inspiring about the work that you do?
I would say the two things. I would say two things. The first thing is working with residents. I think working in an educational kind of environment is very contagious. There's just an energy. There's just a want to learn, and also to make sure we're practicing evidence-based medicine. So I think the first thing is just working with residents and training, teaching, and that energy that comes from that. The second thing is that especially working at a CHC or community health center, you see a lot of human suffering, and at the same time, you see a lot of resilience in people. And I think it's pretty beautiful to be able to work with people and to have them just see their own resilience and what they can do, and to better their lives, whether it's managing stress better or even managing their diabetes better, but to see their own resilience and really start to build up support and compassion for themselves while they move towards the things that they want to do. So I think the patient population at CHCs, and then also just working with the residency, is just truly inspiring and really makes what I do fun.
Okay, and so obviously there's a lot of movement towards integration, and you hear that term a lot. What do you think integration means? What is your perspective on what truly integration is?
I think integration means a lot of different things, but to me, as a behavioral health provider, I'm going to specifically kind of be biased and say when I think of integration is behavioral health being integrated into primary care or family medicine. And I think that looks like teams. And I think not only teams, but that there's no difference in what is perceived as physical health and mental health. It is health. And I think that goes from where you see patients that behavioral health providers and primary care providers should be seeing patients in the same exam rooms. It goes to the same process of being able to get an appointment with the provider. It goes with where you sit at in your clinics, that there's maybe an MA, a nurse, a primary care doctor, a behavioral health provider. Everybody's in the same area. So there is literally no distinction between what is medical care and what is behavioral health care. It is one and the same. It is care and health.
Okay. And so obviously there's a lot of articles, a lot of books, a lot of things written about how to integrate. So can you speak to some of the challenges and maybe offer a few of the solutions to some of the difficulties or just obstacles that you ran into?
I think I've been fortunate to a lot of the places that I've gone for my training, my internship and residency, and then postdoc residency, and where I'm at now. There was some form of integration when I first got there. I think the biggest barrier that people run into, especially starting a new kind of clinic and integrating, is getting buy-in from providers. And I think a lot of times it's more a reflection of the behavioral health provider. You have to be kind of outgoing. You have to be assertive. You have to kind of get in there and make the job easier for the providers. And I guarantee you, and this is the thing that I've seen over and over again, is that when you show the providers that they're helpful, they're going to get on board. So I think one of the biggest barriers that people run into is just getting buy-in. I think the thing that you can do though is be helpful, be energetic, make it easy on the providers if that's looking at their schedules, going to them, huddling them before the day, saying this patient looks like someone I can potentially see, going in before the visits if they're running behind, and then again just doing good clinical work so that they can see that this is a useful thing and that all the research that does back it up we can actually bring to a clinic and actually do. I think also there's challenges because it's hard. I think the most challenging thing is for a behavioral health provider becoming integrated in a primary care setting is that we have no idea what it's like to be a primary care provider. And as soon as you see that, you really value and appreciate what your job is because they have very hard jobs. They have to see a lot of patients. They have to respond to a lot of different tasks. A lot of them work in hospitals and do inpatient service. I mean, they have a lot of responsibility. So I think one of the things that is challenging is that it's fast-paced, it's hard, but there's an appreciation that you are helping someone that is even more having a harder job, that is more busy than you are. And so I think just having that perspective is a way to kind of get around that challenge as well.
All right. Well, Dr. Bauman, it was wonderful chatting with you, and really learned a lot.